Hi everyone, my name is Sabrina and I am bringing to you the first paper of my PhD research, which is entitled Effects of Migration and Vaccination on the Spread and Control of Yellow Fever in Latin American Communities, a Mathematical Modeling Study. Well, in this study, we bring evidence to stop the idea that migrants act as vectors of infectious diseases. Instead, vaccination rates and the type of the vector are way more relevant than migration rates to make an outbreak happen in a community. Here, we have used deterministic but also stochastic compartmental models for human and mosquitoes populations applied to two different scenarios here. First, when people leave a community of origin, which is endemic for yellow fever, and go to a disease-free host community. And second, when the community of origin, which is endemic for yellow fever, is actually a transit community in a migratory route where people cross to reach the host community. And we have found that first, compared in the same conditions, Haemococcus is a much better vector than Aedes for the yellow fever virus. But we should remember that Aedes is well adapted to city and occurs in much larger numbers that could actually compensate its low abilities to transmit the yellow fever virus. Second, here, the partial rank correlation coefficient analysis showed that migratory rates are way less important to an event of an outbreak in a host community compared to the vaccination coverage or vaccination rates and compared to the type of vector present. Here we have the migration rates. Here we have the vaccination rates, and here all the parameters that represent the biology of the vector present, the species of vectors. Next, in both scenarios, we have applied a vaccination coverage of about 90% of all resident and migrant population upon arrival. And then we could reduce the number of cases in 30% in both scenarios. This is compared to 10% vaccination coverage here. And lastly, this model here was applied using the reality of a transit community called Necoclí, a small Colombian city that hosts a number of migrants greater than its own population every year. The yellow fever vaccination coverage in Necoclí has been dropping in the last few years, and in an event of an outbreak, there could be up to 8,000 cases of yellow fever there. But if 100 vaccination coverage is maintained, then it should be able to reduce about 50% of the cases there. So, in conclusion, migrants are not vectors. Migration only introduces a virus in a population, then what happens next depends on vaccination and the type of vector present. So let's stop blaming people who are exercising their human right to migrate, and let's adapt to this reality. Safe migratory corridor could help a lot to vaccinate people upon arrival and protect Latin American communities from outbreaks or even the introduction of the virus in the disease-free communities. Thanks.